We're looking at this week's health headlines, and joining us now is professor at Northwestern University Medical School and Morning News medical contributor, Dr. Stryker. Thanks for being with us.
Good morning.
All right, first up, a nasal spray for migraines approved by the FDA.
Yeah, the Vegepant just got approved, and this is actually pretty good news because there's a group of drugs called the G drugs that help reduce migraine pain, and they work very well, but they're taken orally. And what that means is that these G-Pant drugs, they take a while to kick in. We're talking at least 2 hours, sometimes up to 8 hours. So the beauty of the nasal spray is that it works faster. In the clinical trials, people were getting relief in 15 minutes. It peaked by 30 minutes, and there's really very, very few side effects. So this is a really good thing for people who are suffering from migraines. There are 40 million people in the United States with migraine headaches.
Why are we showing video of fish while we're doing that?
I have no... Fish, do fish have migraines? I don't know.
I don't know. Is that maybe a trigger for a migraine? I didn't know what that was about. Maybe that was our mistake.
I don't know.
Okay. That has nothing to do with it, though.
Nothing to do with it. But the other downside to this, the only downside really to this drug, is that it's not going to work for everybody. It would only helping maybe 25% of people, which, you know, is not great. But when you've got 40 million people with migraines, anything to add to your toolbox is going to be helpful. And the other last thing is a lot of people have nausea and vomiting, and they can't take an oral because it's going to come up. So the nasal spray is going to be helpful for them as well.
All right, up next, common myths about cancer risk factors.
This study absolutely blew me away. This was 5,000 Americans that they basically had them fill out a survey about things that are going to increase their risk of cancer. And people have no clue. It's like 80% of people, first of all, thought that cancer is always hereditary and there's nothing you can do that's going to change that, and that is simply not the case. We know that you can reduce your risk by about 30% by making some lifestyle changes. So the big three, there's three big risk factors that they looked at. The first was obesity. Only 30% of people were aware that obesity is associated with cancer. And we're talking breast cancers, uterine cancers, common cancers. The second was tobacco. Now, this really surprised me because I thought everybody knows that tobacco causes cancer. Only 50% of people were aware that tobacco is a risk factor for cancer. And of those 50%, they thought it was not the number of years you were smoking, but the number of cigarettes. And in fact, it's the number of years, not the number of cigarettes. The other thing is there was this idea that you can exercise away the impact of smoking on your lungs, and that pollution is a bigger factor than tobacco. So that surprised me. But the biggest one that people are just not aware of is alcohol. Only 1 out of 3 people are aware that alcohol is associated with many, many cancers. And even more frightening, 1 out of 4 people believe that 1 drink a day is going to reduce your risk of cancer, and in fact, it's the exact opposite. It increases your risk. So there's a lot of people, you know, don't know that there are things you can do.
Well, what is the number of, I mean, that's a pretty broad statement. 1 drink a day could cause cancer?
1 drink a day is associated with cancer. So the feeling is if you put these 3 factors together, and I actually have a podcast on this, how to reduce your risk of cancer by 33%. If you even just do those 3 factors, you don't smoke, have a healthy weight, and avoid alcohol,
altogether?
Ideally, or at least whatever you can do. But the point is you can reduce your baseline risk of getting cancer by up to 33%. And people just think they have no control. You know, that this is just inevitable, and it's just not true.
All right, and the impact of switching to daylight saving time.
Yeah, we're all still suffering from the impact of changing our clocks a few days ago. I mean, the number one thing that needs to happen is we got to change this law already. 3 states have already done that. We know that there is a profound effect on your circadian rhythm, which doesn't just last a few days. We see the impact for a full month, and we're talking about things like increase in fatal car accidents. Kids can't concentrate in school. Doctors are making mistakes, more suicides, more heart disease. I mean, the science is really solid that there are big repercussions from this spring forward thing. So it's not too late. What you look with the sleep experts have a few suggestions to kind of get your body back into the right rhythm. Number 1 is when you get up first thing in the morning, expose yourself to sunlight right away. We have to hope for a sunny day here in Chicago, but get up, get out of bed, open up all the drapes, put yourself right in the sun. And the other thing is not too late to kind of just gradually ease into it. You know, go to bed 15 minutes earlier for 3-4 nights in a row. But the main thing is we got to change this.
All right, you can check out Dr. Stryker on social media. Thanks again for being here.
Thank you.
Thank you.
Time now for Around Town. Hey, Anna.
Good morning. I'm in Oak Park at WonderWorks Children's Museum.